Julie Quenneville is the CEO and president of the MUHC Foundation, and we've spoken to her before. She used to be hosting Health Matters before her busy schedule forced her to turn things aside and turn it over to Tara Schwartz on Sundays here on CJAD 800. And Julie's on the line to talk about what we're grateful for on this holiday Monday, especially in our healthcare industry. Julie, good morning.
Good morning, Ken. Thanks for the invitation.
I've always maintained that in a perfect world, once we got past this pandemic, we could have a parade, a huge parade for everyone who's been on the front line during the pandemic and just applaud their sacrifice and their hard work. And there's no shortage of those stories in the healthcare industry.
I completely agree with you. And to also help them deal with the grief and what's past. And what most people don't really see is the next big crisis in healthcare that's just brewing. For 18 months, there are many cardiovascular disease and cancers that were misdiagnosed or not diagnosed at all. And so it's not as though our healthcare workers are beginning to get a break because the pandemic is starting to die down slowly. They are still being called upon to care for us. And they haven't had a break. They're exhausted. They're drained. And they really, really need to feel the support of the community, Ken.
Tell me about just witnessing that exhaustion and that fatigue and that stress level.
It's been so sustained for so long, as you can imagine. Think about a big shout out to the ICU nurses and doctors. In the beginning of the pandemic, the death rate in the ICU for COVID patients was about 25%. Mm-hmm. They didn't have the opportunity to grieve with the families and to deal with that kind of loss. They just had to keep going, and they had more and more and more patients. And we still have COVID patients in the ICU. And so today, we're now asking them to, tighten up and continue, because now we have cancer patients waiting for surgery and lots of advanced cardiovascular disease coming into the hospital. So it's extremely difficult for them.
We're with Julie Quenneville this morning, president and CEO of the MUHC Foundation. Tell me about the program that's in place. I guess it's a recognition program for healthcare workers?
Exactly. Our patients were always telling us that they wanted a more concrete way to say thank you to the caregivers. And so we created a program called Hospital Heroes, and patients can make a donation, and their families. I've made donations for the caregivers that have taken care of my mother, for example. And the caregivers get a pin with a Hospital Hero symbol on it, and it's extremely touching for them. We've actually launched a couple months ago a monthly Hero of the Month to honor some of the doctors and nurses who have been highly recognized. And this month, it's one of my favorite doctors, Anthony Zaytouni, who received 44 pins already from his patients. And I get a lot of calls, actually, from his patients, Ken, and they say that what is extremely touching about his care, he's an ear, nose, and throat specialist,
right,
is that they feel like he really cares, and he makes follow-up calls at home, and he cares and speaks with their family members, and always goes above and beyond, and that's extremely meaningful, especially for such stressful diseases.
Oh my God, these people! I'm telling you, he's earned every one of his 44 pins. It sounds like.
Absolutely, and this is our little way of helping and showing that we are supporting these healthcare workers who've been under so much stress. Another one that Ken is obviously the Sarkis Metarisian. I know we've talked a lot about him.
Yeah.
He's
and that great head of hair he has.
He has absolutely beautiful hair. I had no idea how beautiful his hair was, but boy, did he ever go above and beyond in growing his hair for a few months. And he'll be shaving his head soon. And now Avon Canada has offered to match $1-for-$1, dollar-for-dollar donations that come in before October 31st in support for him. And this is all to provide wellness support for breast cancer patients and their families. So things like physiotherapy, nutrition, sexologists, social support. So very important.
So I understand, if I'm not mistaken, he had raised his goal of fundraising to about $200,000. And so you're telling me Avon's going to match that?
Exactly. So Avon is matching dollar for dollar any donation that comes in between now and October 31st. So let's help Dr. Metarisian in this mission. And of course, we'll be looking forward to watching him shave that beautiful hair.
Julie, if people are listening and want to donate, do they find the link to support him through the MUHC Foundation website?
Yeah, cover page, MUHCFoundation.com, and so they can find him and support this great cause, or if they want to thank one of the hospital workers, that's that's gone above and beyond for them and their families. Please find the Hospital Hero program.
And Julie, we just have about a minute and a half, 90 seconds, but I was speaking earlier in this half hour about the late Dr. Nadia Chaudhry, and she passed away from ovarian cancer, diagnosed only 3 years ago. And I know that's a topic, and that's been an issue that's come up several times on Health Matters about how frustrating it is about ovarian cancer. It's a silent killer, and how important early detection is.
What a heartbreaking story that is. I mean, a young mom like that should absolutely not be lost to cancer. And we're seeing so many of these, and there are many women that I work with every day whose stories are very similar and who are fighting with their families. We have a project now called Dovey, and Dr. Lucy Gilbert was actually her doctor as well, and she fought very hard with her. The reason that we lose so many women to ovarian cancer is that we can only diagnose it in phase 3 and 4. It's too late by then. But if we can diagnose it in phase 1 and in phase 2, we can actually cure this cancer. So Dr. Gilbert, over the last few years, and it's 100% covered by philanthropy until recently when she finally got a grant. We matched it from Genome Quebec and Genome Canada to develop. It's already developed. We're just doing the last phase of the clinical trial, and it is the first test to actually see and find ovarian cancer in phase 1 and phase 2. This is a game changer. It's going to transform women's lives all over the world, and we just need to finish the last 2,000 women, and then we can bring it to market in every doctor's office in the world. So we're really eager because every day that we don't get this done is another woman that we lose, and that it absolutely has to stop. So Dovey, very important project, and a big thank you to Dr. Lucy Gilbert, whose courage and determination has brought us this far.
Very good. Julie Quenneville, CEO and President of the MUHC Foundation. Always a pleasure talking to you and having you on the show. A happy Thanksgiving, Julie.
Happy Thanksgiving to you and to your listeners.